Hello, this is Laura on for Jim Malloy from AGP. Thank you for the great presentation and for taking the questions as well. So maybe a question for Dr. Aleman. So in regard to the safety of this therapy, you mentioned mild adverse events and no dose-limiting toxicities among the patients treated. And in comparison to other gene therapies, especially Luxturna, as it's known to cause side effects such as cataracts and retinal abnormalities. Do you anticipate this positive safety profile gathered to continue, especially as you start dosing pediatric patients and progress further until its clinical development?
Thank you, Moss. Thank you very much for the question. It's a relevant one, especially when we are planning to see children. I hope so. I hope it will continue to show the profile. It's very hard to extrapolate from just 3 patients. We have to see many more. In principle, we are expecting the same type of safety profile as the many other gene therapy trials. Whether we exceed or fail in achieving that, time will tell. The design of the next phase of the trial would maintain the design of including basically a sentinel patient, which is going to always be an adult in each one of the dose escalation phases before we include children. And we are trying to do the same. So we're going to be careful with immunosuppression to try to prevent inflammatory reactions from occurring in the patients. From the surgical point of view, it's the same. The profile is a little bit more known since we have done many of the other interventions as well, countless of experiments in NHP, non-human primates. So we know about that a little bit better, but it has to be the risk as well. We cannot ignore that part of the equation. The development of cataract so far, we haven't seen any. Maybe it's because we're just lucky that these 3 patients were basically are free at 12 months. But we have to just keep an eye open for toxicity as we move forward, and that's the main reason for the trial.